Good morning, everyone. The tragedy is so many doctors are dying of either heart attack or due to multiple complications. Why? Because in medical college during MBBS course, when I say doctors, majority are MBBS doctors. 65 to 75% of workforce of medicine is MBBS doctors. When they join in physiology about insulin, we tell only few lines. So metabolism is one subject which is missed in a MBBS course. Metabolism, nutrition and immunology. These three are the core differences which have happened last 10 years. People have started eating in a different ways. Always life will be before textbook. So there are a lot of changes have happened, environmental changes have happened, the type of family planning has changed, the nuclear families are there, and old traditional cooking completely has changed. Now there is globalization of food and people are eating from different time zones and from different formats and different ways of cooking. The way kitchen also has changed. All this has impacted in the inflammation of the body, immunological changes in the vascular system as well as in the pancreas, and also there is a difference in the metabolism and nutrition, especially with the electricity production has gone up, and last 10 years the sleeping cycle has come down from 8 hours sleeping cycle to people are sleeping less than 5 to 6 hours. And most important for India and China and Asians are the sleep pattern is now linked to Western civilization. So to earn money, more and more people are waking up late in the night, and now the culture has gone up. Nobody is sleeping by 9 p.m. So the agriculture model has gone. So for MBBS, average MBBS doctor, when they join the medical college, physiology about insulin and insulin metabolism and adipose tissue, we don't even tell them, or the penetration of subject is very low. Next is by final year when they pass, only 1 or 2 lines will be there about insulin resistance and diabetes in all the major textbooks. So as you can see here, the main missing link for MBBS students is we are not teaching them the metabolism. So insulin metabolism is missed by majority of the doctors. Second is after the MBBS, mostly other than MD General Medicine, there is no revision of subject. And if they go to specialty, basics of diabetes, insulin metabolism is lost. So 90% of the core of the medicine they don't know about insulin and insulin metabolism. So the doctors are not trained for metabolism. So except physicians, no other doctors in other specialties, rarely they come across insulin resistance and insulin metabolism and link to diabetes. Last 10-20 years, the obesity rates have gone up in India, and there is no exact knowledge, and we are not testing insulin in India. So we are still in the UK PKDS study which was there 40 years back about blood sugar. So we are still in the glucose box. Average doctors are knowing only about fasting blood sugar, random blood sugar and HbA1c, because there is no teaching in the medical college. So what is happening is a lot of doctors are dying because of obesity or diabetes or hypertension or coronary artery disease, just because we are not taught in the medical college about insulin metabolism. So I have started an institute for 12 months course for general public and for doctors also, to understand how the insulin behaves in each individual. That is where I am doing fasting insulin and post-lunch insulin. I am tying up with the waist circumference. Unfortunately, still we are in BMI, basic metabolic index will give you a wrong indication, because weight by height square is abnormal in only few patients, whereas waist circumference changes very early. So any Indian with more than 85 centimeter waist circumference you have to think of abnormal metabolic syndromes. Metabolic syndromes are called as either insulin resistance syndrome or they are called as syndrome X or metabolic syndrome. So as you can see here, the obesity rates are in India are climbing very quickly, and the penalty is paid even by doctors, and a lot of doctors are having sudden cardiac arrest and deaths. The basic thing is we are still in thinking that till 85% of pancreatic beta cells are destroyed or HbA1c and blood sugars are normal. So doctors don't know that there is a hidden diabetes, that there is a change in 10-15 years ahead. The triglycerides and HDL will change. Adipose tissue is an endocrine organ, and insulin resistance is the key for fatty liver and coronary artery disease and diabetes. This point we are not teaching in medical college. So a lot of doctors, they don't know, and there is no change in the way of teaching, and only few lines are there about insulin resistance in entire diabetes textbook. Average MBBS doctors, once they complete their MBBS, if they join the government service, the knowledge is zero, and if they join paramedical services, the knowledge is zero. They are more of administrative side, and with the load of patients to acquire extra knowledge from CMEs is zero. That is the reason why I took even lot of senior doctors, they still don't know about insulin resistance. The knowledge is zero. So nothing wrong in it. We need to change with the time. People have started eating more and they started becoming obese. So till we need not wait till the end of all the beta cells are destroyed, then becoming diabetic. 10-15 years ahead, we can make out who will get diabetes, who will get heart attack. Specifically for India, I have started a coaching center for 12 months, and also 1 month short course is there. Any doctor is interested, they are any public are also I am giving classes for them. My name is M Surendra Nehru. My number is 0963721999. My website is www.homahealthcarecenter.in. You can see my videos, Homa Surendra Nehru. So from next month, I want to start classes for everyone, online and offline. So you can kindly contact me. Thank you for this, for general public and also for doctors, because we are not knowing about metabolism, immunology and nutrition. These three are missed in the average medical college teaching. So unless we upgrade our knowledge, the way of old teaching, where we are still believing in the old UK PKDS and all those American Diabetic guidelines which rely only on glucose, it's a failure. So we have to change with the time. HbA1c is the last test. A lot of things happen before HbA1c. Just based on HbA1c and blood sugar, you cannot change the diagnosis and treatment. Thank you. Surgery and all. So average MBBS doctors won't be knowing all this.